Hey, today's Friday, the 9th of October, and I had the revision done 2 days ago at Dr. Feledy's office, and the appointment was at 4, and we waited till 6 for him to actually come back. I was taken back about 5, and then I had two, like, dressing gown bathrobes, whatever. One was a normal size, and then the one was a man size one, because I was so cold. And finally he comes back at 6, and we went to another room. It was still another examination room. So I was put on the table, and he did the right side, and he did that in about 25 minutes. He cut a strip off, and to take away the dog ear, I guess that's what it was. And then he stitched it back up using whatever stitch they use in plastic surgery. Then he did the left side, which was the tricky side, and he did it one time, and he cut it, huge wedge out, scalpel. He did, I think it was 4 lidocaine injections on the right side. He did about six or 7, I think, maybe on the left side. And after he cut the first time, I felt it towards the back, and so he cut the bottom as well, underneath the incision, and I felt that as well. So he then goes and gets some more lidocaine, and gave me some more shots inside, I guess inside the incision that he'd made. I don't know, because I wasn't watching. Wade was watching it all. And then he pulled up with tweezers, and he was cutting with these scissors that had like curved blade, whatever. So he'd cut, and anyway, he did that. He said the swelling was pockets, and he had a name for it, but I've forgotten what it was. Oh, that's a new color. It's the same as before. It was a combination of this on top of the base coats, and then a clear coat. Anyway, that was neither here nor there. So he does, my fringe is all curled up. It's not that short, it's actually quite long, but I curled it up a little because it was so long. My hair looks like crap because I haven't straightened it, because I've been in a little bit of discomfort. Anyway, so he did it the one time. He said there were pockets of fluid, which is why it was so swollen. So he burst them, I think. And he cut out scar tissue and stuff. And he sewed me up. And I stood up. And he said, "Oh, I don't like that. Let's redo it." I said, "Okay." He says, "Well, look, you want it done right, so let's redo it." So he takes all the stitches out off the left side, cuts more away, bursts some more fluid sacs, and then oh, I've got a temporary tattoo on over the cyst scar that I have from years ago. Anyway, he did some more, sews it back up, did a couple more injections because I started to feel, because he was going deeper right towards the muscle wall. And at one point I felt a nerve twang that felt much lower down. I thought, somebody swacked a rubber band or something, but it was actually my nerve, some nerve he severed or something. I don't know what he was doing, but it felt lower down. So I actually jumped, and he was cutting, and I was like, ah! So that was horrible. But anyway, so we were talking, all three of us were talking, and he'd make a joke, we'd make a joke, he'd make a joke, and it was quite funny, odd, surreal. So anyway, I stand up after he sewed me back up again, and he says, "I still don't like it. It doesn't look right." And I'm like, okay. He knows that he has to do a good job. I said, I love the front. Didn't like the sides, especially this side. Didn't like this side that much, but it wasn't awful, but this side was terrible. Anyway, so he says, "Okay, let's do this again. Could you stand up for it this time?" I said, "Fine, okay, I'm not feeling much of it." Anytime I felt anything, he said, "Okay, let's stop, renumb you up." And, he was cauterizing as well, so every time there was smoke and flesh smoke, cooking smells, and Wade was saying, "Oh, I think we'll have barbecue for dinner tonight." And I was like, "You are so funny. Hilarious. Ha ha, ha ha." Anyway, so he cut more while I was standing. He took all the stitches out again. starts cutting some more. While I'm standing, I'm feeling like blood and stuff going down my leg. This is how I imagined, actually, that was going to happen. And I was still wearing my freaking bare paw boots. And I'm thinking, I'm going to be collecting blood and liquids into the boot. Anyway, so he was wiping as he went and stuff, and he'd cauterize as more blood vessels were cut and stuff. And I'm standing there going, what am I doing? And he says, God, this is taking more than your actual surgery, the actual tummy tuck surgery. Anyway, so he cuts some more, and he starts to do a little bit of stitching, and he says, oh, that looks much better. So let's go back on the couch and lie on the side that I've already done, and I'll stitch it up while you're on your side. So anyway, he's like, blah, blah, and he says, do you want to take some of these strips of flesh to your dogs at home? And I said, oh, yes, I'm sure they'll love that. Barbecued me and strips of flesh, and that was a joke. He works really long hours. He was telling us how he hadn't seen his children since the weekend. I'm running all over a bath, if you can hear the water. And his daughter wanted to show him something about something she was doing in school. He's got two children, boy and girl, and they hadn't seen him for ages, and so he kept saying, I have to call my daughter by 8. And it was after 8, and I said, do you want to stop and call her now and stuff in between? Like every time he'd stop and say, oh, I'm going to redo it. Anyway, so the third time he does it, he says, I think this is it. I think this is good. I said, I couldn't even look at it, because at this point I hadn't eaten, and I was so freaking, I'd gone through hunger, then non-hunger, then I was shaking because I'd gone past hunger, and I was thirsty, I had a headache, the horrible tube lighting above was had given me a headache. We'd started with the windows, like the blinds up and the windows open so that he could get the outside ambient lighting, as he said, but also with the overhead. Anyway, so he did it 3 times, the left side. He says, if we have to do it again, we'll look at it next time, and if we have to do it again, we'll do it again. I mean, he's determined to get it right. He seems like a really fabulous doctor. I don't like the way they make you wait, though, that office. Maybe it's because he's the only person and he's very busy in his practice, but I really dislike the waiting. And the not being able to get appointments for weeks. He wanted to see me next week, but Billy's working on Wednesday, and it's in Fredericksburg, so rather than locally. So I said, could we do it the following week if it's local? And they said, yes, but we'll call you. Donna called me yesterday, and she said, how's it looking? And I said, well, it's so swollen. It wasn't swollen like this last time. And she said, well, he did a lot of work. I said, I can't tell right now what the results are going to be because it looks so swollen. I had another thing with the nerve thing the third time he did it. So I noticed yesterday, this is like the second day post because this was on Wednesday, now it's Friday. I noticed yesterday that I had numbness where I didn't have it before on my hips. So I'm thinking maybe because of the nerve thing. Anyway, last time when I actually had the tummy tuck, I had a pain pump for 72 hours. So I had no pain. And then I also had a pain medication, and I've forgotten what it's called. Was it this one? No, this is an antibiotic. I had a pain medication that I had to take, and I also had the Percocet, which I chose not to take because I wasn't in pain. But this time I've got to say it is so much more painful than it was last time. I'm feeling it a lot. I didn't feel it last time because of the pain pump and because of the pain medication. I still have the Percocet from last time, and I haven't taken it. But I'm taking Tylenol every 4 hours or every 5 hours or so during the day because it really gets sore if I don't move. I actually worked out yesterday on the treadmill for an hour. I'm going to do it again today for an hour, and I've also done weights today. I think the moving's actually helping because when I'm lying down, I can't lie on my side again, so my lower back's starting to hurt like it did last time. I also didn't have bruising last time, which I have this time, which is really odd. And I'm really, really swollen on the left side. So anyway, I'm going to do a little... Ow. It really is sore. Okay, so the right side. Ow. Okay. The right side looks, I mean, it's covered. It's not swollen. It's a little tender to the touch. And it's a tiny, tiny bit swollen. But it really doesn't look awfully bad. Okay, that's the right side. So with this across there, you can, I mean, a little swelling, but you can't really tell. Now, as for this side, I mean, you can tell that it's so really swollen. I pull this down and look. It is so freaking deformed and swollen. It is it's really, really hard. Like it's filled with liquid again or something. And he said that the swelling would go down like before, what he did. But he said taking out the swelling pockets, whatever, the fluid pockets. But he said it could take years for the swelling to go down. Anyway, something else I never had before was all this freaking bruising. And all along here, absolutely no sensation here at all. So I'm not sure if it was like nerve stuff, the stuff that twanged and popped. I don't have sensation here now. So it's like the front now, no sensation. Here it's just really feels really super sensitive up here and very, very swollen. And as you can see, there's bruising. See how shiny it is from this, how pulled the skin is? Anyway, there's a lot of freaking bruising there. And he said, he kept saying there was a lot of puckering. Oh, and as you can see, it goes further back now. The stitching has gone further back. It was up to about here before, I think. And now it goes to here. So yeah, but it's really, really, really sensitive. And he said, yesterday Donna said that I should compress it. Ow. But yeah, so that's that. Anyway, so that's 2 days. But last time I didn't have any of this freaking pain, and this time I've got super sensitivity and pain. So that's my update for now. Was anything else? I don't think so. Wade said that if he had to redo life again, he'd probably be a doctor, because he didn't have any problems with watching him cutting me and slicing with a scalpel and then taking scissors and cutting bits of flesh off and all that kind of stuff. So I thought that was kind of gory. I didn't watch any of it. I just couldn't. Had it been somebody else, I probably would have watched it, but because it's me and I was actually going through it, maybe if we'd filmed it, I could watch it later. But I just couldn't imagine watching it as he was doing it and pulling flesh off and then cutting it and stuff. Anyway, so that's it. Day 2. Oh, I'm on antibiotics again, augmentin, and they are doing a number on my digestive tract. And I'm not enjoying it at all. So that's something else. Yay. Oh, weight loss this week. No weight loss. I think I've gained a whole bunch of water. There's absolutely no increase, no loss. I wasn't expecting to see a loss because, I mean, I haven't been eating excessively or anything like that. It's just that I'm so swollen. I don't know. Or maybe I just wasn't due to lose any this week. I don't know. But, I mean, I've still been working out and I'm still doing the same eating wise. Anyway, that's about it. I thought I'd do a quick update, and that's it for today. Please subscribe if you want to hear more about my progress with the weight loss and with the tummy and all that kind of stuff. And thumbs up for whatever. Any questions, ask below. And I will see you next time. And next time maybe I will have done my hair. I did my nails. Priorities, you know. Anyway, see you next time. Bye.